Hello and welcome. If you're at the door, do please make your way in. Congratulations, everybody. You are marathon runners. Here you are in the afternoon session, having survived thus far. Well done. We've got Samo Farah, the long-distance runner, in tomorrow. And you're all doing your own long-distance conferencing today, so well done. It's great to see many of you here. This panel, I think it's extremely sort of meaningful to me because it's addressing an issue which perhaps the COVID pandemic and everything that went with it brought home to all of us who do not work in the healthcare sector. That is just the enormous sort of strain and pressure that people in health and care roles in the health sector face every single day of their working lives. And it's not as though that wasn't true before COVID. Of course it was, but I guess COVID-19 and all of the sort of pressures that came with it showed us outside the sector what it really means to be committed to a professional life of health work, in health work and care. So I'm actually going to begin, if I may, by raise your hands if you are a health and care worker. I'd just be interested to know in our audience how many. Oh, yeah, a lot of you. Well, I'm so delighted you're here. Thank you for your service, as they say, but also thank you for your attendance right here, because I think this conversation will be very, very interesting to all of you. Let me introduce my panel, and I should say, of course, I would invite you to go to the Wish app, look at the forum report which has been produced on this subject, and the headline, of course, is Our Duty of Care, a global call to action to protect the mental health of health and care workers. That's what this is all about. The forum report is out there. I would encourage you all to take a good look at it if you can. But our panel is here to discuss some of the report's findings and to look ahead and to think about how we can address the very real challenges that face health and care workers and how they can best be safeguarded and given the right working conditions and the right support. So on my panel, let me introduce them just in the order they sit. So at that end, welcome, please, Jim Campbell, who's Director of the Health Workforce Department at the World Health Organization. And I should say Jim also co-authored this report. Next to Jim is Rafiat Akinokun, who is a registered nurse and an immunization advocacy worker in Nigeria. It's great to have you here, Rafiat. Thank you very much for joining us. Right next to me is a minister from Egypt who is a very hard-working minister because he's just done a panel with me and he's agreed to come across and do another panel with me. So thanks very much, Professor Dr. Khaled Abdul Ghaffar, who is Minister of Health and Population in Egypt. It's a great pleasure to have you on stage again. Thank you for joining us. On this side, please welcome Dr. Hanan Abdurrahim, who is Associate Professor and Dean of the College of Health Sciences at Qatar University. And Hanan is also a co-author of the report that I've been referring to. And at the end of the panel, right next to Hanan, is Howard Catton, who is the CEO of the International Council of Nurses. So I know you've wanted to give them all a warm welcome. Now's your chance to do it. Give them all a big round of applause. So, panel, I tried just to lay out a little bit of what this report is about. It really is addressing something that COVID perhaps brought home to everybody, but which was already a huge sort of structural factor in healthcare services around the world. That is the pressures upon and the mental health issues that are faced every single day by care and health workers because of the work they do. And this isn't just about, you know, what sometimes are referred to as the frontline workers. I mean, doctors and nurses, of course, are hugely relevant to this conversation, but so too are the hospital porters, the people who do the unseen work in hospital kitchens and who also face all of the issues that were highlighted in the pandemic of the risk factors, the need to self-protect as well as care for others, all of this stuff which happens every day in our health services right across the world. So it's a very live and real issue. I'm gonna start with you, Hanan. You are co-author of the report, so give us an overview of what you see happening to mental health and well-being of health and care workers right now.
Okay. Well, thanks very much for this question, Stephen. I think you absolutely rightly pointed out that this is not a new problem brought about by COVID. So certainly the high levels of stress, of anxiety, of depressive symptoms, of burnout were there. And there were reports that really flagged that, like the US Surgeon General's report and others, and other professional surveys that flagged these issues. So you can imagine that the health and care workers went into the pandemic already with these high levels of poor mental health outcomes. And then you saw, and maybe the audience, when you get a chance to read the report, you'll see that the levels that we're talking about, they're quite high. I mean, at the best of scenarios, and by that I mean the lowest estimates, you're talking about 1 in 5, reporting depressive symptoms, anxiety symptoms, and sometimes that goes up to 1 in 3 and even 1 in 2. And when you talk about burnout, something like 2 out of 3 of nurses and physicians, 2 out of 3 reporting burnout. So those are very high levels, and we got that from an academic review of systematic reviews, so a whole lot of studies that then reported on smaller studies and pulled the findings, but they were also triangulated from other sources. So when you look at the Workforce Intelligence open source, which is basically looking at what social media is saying and what the talk was about, we get the same results. When you look at the professional association surveys like the BMA and the NHS and so on, they're saying the same thing. So they all triangulate to show this the same picture. I think one thing I'd want to add, though, is it's not really only one picture as well, and it's not one point in time. So if you look at what happened over the course of the pandemic, and we were lucky to find some surveys that, and some associations that were repeatedly surveying their employees, right? So almost on a monthly basis, sometimes on a weekly basis. So you saw how things changed over time. And initially it was the anxiety and the fear. How is this virus transmitted? Do we have enough PPE? Am I taking it home to my family? So, very scary issues. It gives way to exhaustion and burnout after a while. And then there was the vaccine. And so there seemed like there was going to be a silver lining, and then there was a backlash against health and care workers because of the politicization of the vaccine. And so that brought about, more negative feelings, anger in some cases, feelings of betrayal by the health and care workers. So it's quite a journey that they've been on, and I hope that the report's been able to convey that.
So is this a story of long-term systems failure then, that long before the pandemic, systems didn't pay enough regard and take seriously enough the mental health issues facing health and care workers?
Yeah, I think that is true. I think certainly, there's a lot, and you saw that a lot in the pandemic. There was a lot of appreciation and valuing of health and care workers by the public, and that's of course very welcome, and that's very positive. But the fact is that to even start out the pandemic with those high levels of anxiety and burnout, then yes, the system has not adequately dealt with the stressors of these positions, which again are stressful under normal non-pandemic circumstances.
All right, well, that's very helpful to set this up. Howard, I want to bring you in, but as I bring you in, I want to see if our team can bring up another chart, which I think is quite useful. It's about the levels of departure from the healthcare sector. And I think if we can look at it, actually, my eyesight's so poor, I can't even quite read it from here, but I think, well, if I turn around, maybe I can. Yeah, let's have a look. Since the beginning of the pandemic, have you considered leaving your current profession? and no is at 44%. A third of people are looking at finding a different role, and 23% are wanting to get out entirely. So 56% don't want to stay where they are, which is more than half. So, I mean, Howard, does that ring true to you? Because you obviously sit there looking at an international perspective on what is happening within nursing.
It absolutely does. Firstly, let me bring my greetings from the International Council of Nurses to you all. I've seen there's an awful lot of nurses who are at WISH, and I just want to give a shout out to WISH for their support for nurses and for healthcare professions. It's great. Just in terms of what we know, Hannah's point about the weaknesses within the health systems before the pandemic, we can put one number on it because we did it with WHO. We were 6 million nurses short before we went into the pandemic. 28 million nurses worldwide, that's about 20%. You imagine in your daily job, you go into the biggest challenge you've ever faced, but you're already 20% down. We've been talking to nurses right from the start of the pandemic about the experiences, and mental health has come out there from day one. And I've been struck by the complexity of issues. Yes, stress and burnout, of course, but we've seen nurses abused and attacked. A story of a nurse who had chlorine thrown over her because a member of the public thought that she was a vector for a disease. Nurses who were having difficulty renewing tenancy agreements, again, because of fear from their landlords, and then coming off shift and having the anti-vaxxers saying, it's a fake, it's not real, just whilst you've been dealing with the, with the cold, hard reality of the pandemic. And people often say, oh, nurses, you're used to dealing with death and dying, aren't you? The intensity of this was something quite different. Nurses going from grieving patient to grieving patient. They're used to being there at the bedside with the relatives, but this was stepping into the shoes of relatives, holding the laptop or the phone as well. We called this early on in the pandemic the mass traumatization of the nursing workforce, and some people thought that was a bit harsh, but if I look back now at that evidence and see what's in the report, I don't think it was over the top.
You mean like a clinical diagnosis of PTSD sort of trauma?
We were absolutely seeing nurses with symptoms of PTSD, some small but tragic number of suicides as well. But nurses who, I talked to nurses and said, you must be talking to you must be getting a lot of support from your family whilst you're going through this. No, Howard. Family don't want me to go to work. They're worried. The kids are saying, do you need to go? So I don't talk to them. You're talking to your colleagues. I know they're struggling, yes, a bit, but they're struggling as well. So where the sources of support were coming from, at the same time as we had this hero narrative. You're invincible. You don't need the PPE. I know people didn't say this, but almost that assumption, you don't need PPE, you don't need the vaccines as well. I think we're seeing a bit of a backlash from that now. And there was one other factor, just to share with you, because I don't think this is in the report. We talked about it a lot in nursing, but I just want to put it out there because it feels very, very significant in terms of the numbers of people who are leaving. We called it a moral injury. What many nurses were very, very conscious of that was that every day they felt they weren't giving enough for their patients. They're trained to incredibly high standards, to codes of ethics that demands putting the patient first. But on a daily basis, it's like we're falling below that standard. People were feeling compromised professionally and personally, and that's one of the factors, along with the lack of protection value that's resulted in people leaving. That 6 million, we believe, could be doubled. It's a result of aging and people leaving as a result of the pandemic. We called it the COVID effect. You're seeing that translate into numbers now. I saw just from the UK in the last week a big jump in people who are leaving the profession. And that result of people leaving, these are tough decisions. I'm a nurse, and people who are nurses feel it's part of their DNA, it's part of who they are. So to leave, to come back, isn't necessarily something that people are going to do.
Howard, is there not a danger that you're conflating, the very real trauma and issues surrounding, COVID and what health and care workers went through with just a basic discontent with levels of pay and resourcing which is a different set of issues. Not to say they're not serious and not real, but they're just different. Are you not confused?
I think there's a common. I think there's a common thread, and that common thread is the historic lack of value of the work that nurses do. You know, we talk about. I listen a lot to the politicians at the moment when they make the case for investment in the economy, and when they talk about we need to spend money on infrastructure, on roads, on new technology. It's all about investment. You never hear that about nursing. It's always about the cost of nursing. They never talk about the complexity of what nurses do. They talk about the care. But do you know the other thing I noticed? That whenever politicians often, when there is examples of waste, they use nurses to quantify it. How wasteful that is. Do you know that could have bought 10 or 20 nurses? It feels like we're often the most common currency, but the most devalued currency. And I think there's some deep historic inequities based on the fact that 90% of my profession are women as well.
Okay, well, that's powerful. It really is. I'm going to go to Jim, another co-author of this report. And, you know, I don't want to be gratuitously devil's advocate, Jim, but, you know, this word that people now use when they think an argument is a bit too sort of weedy and liberal, they call it snowflakey. Could it possibly be snowflakey to be so preoccupied right now with the mental health of health and care workers when, you know, they sign up to do a very difficult job, they are very committed, it's vocational, and they are by and large seen as very resilient workers? Are we just getting them wrong? Are they not as resilient as we thought, or are we perhaps indulging ourselves with this discussion a little bit?
I think there's about 6 questions.
Take any of the 6 you like.
But let me pick up on something you mentioned earlier when talking to Howard, if I may, because you said, is this not just, you know, poor resourcing, poor pay, and you know, we're looking at the WHO has just published guidelines on mental health at work, all work, not just health and care. And what's the evidence that we know? What are the risk factors? Poor resources, poor pay, being perceived as undervalued, harassment, abuse, and sexual harassment at workplace. And if you look at these list of indicators, all of those are heavily present in health and care occupations. And I think we have to recognize some of that. And the point that Howard makes about 90% of nurses around the world being women inevitably brings into some of these issues about pay. Women are underpaid compared to men in the health and care sector. It's evidence. So if it's a risk factor for mental health and we continue to ignore it, to come with it. You've mentioned both of us as co-authors. Let me come back to the other question. We're also joined by some colleagues in the audience who are co-authors and members of the expert advisory group. And we had this discussion, not snowflake, but, you know, about the perception of health and care workers, their resilience under the pressure that they face. And what was the evidence telling us? What were the discussions around it? And we make a very clear statement in the report that we deliberately do not refer to the resilience of health and care workers, because the figures you've heard from Hanan, this is a normal reaction to a set of abnormal circumstances. The pressure that health and care workers around the world have been through for the last 2 years far outweighs the normal pressure, the intensity of their occupations. And it's absolutely normal to therefore the symptoms that are being manifested in individuals is what we would anticipate to see. But they're rooted in the systems in which they work. It's not about whether a health worker in Nigeria has the resilience to cope with all those pressures. It's not about whether somebody here in Qatar, an emergency medicine physician who was in the immediate response to the first wave, who may have had all that death and injury in front of them, is going away with PTSD. It's not about their coping, it's about the systems in which they work. And so we made a deliberate choice to distinguish between that human response and an organizational responsibility to protect and safeguard workers. You know, we talk always with our healthcare professions. Your role is to protect the patient. Your role is to serve the community. Your role is to do this, to do that, to improve population health. Where's the dialogue on the protections, the safeguards for the health and care workers to do that? So it was a very deliberate choice to come.
Okay, well, that's interesting. Rafiat, you've been listening patiently. I would love your perspective. Tell us a little bit about your experience through the pandemic as a nurse in Nigeria. What you know, what was it like, basically, and how much did you feel that the facilities in which you were working were mindful of protecting you, as well as obviously offering the very best treatment possible to the patients?
Okay, thank you very much. So the COVID-19 pandemic came to us unprepared, and working in unhealthy...
Rafiat, because your voice is beautiful and soft, do hold the mic as close as you can.
Okay, this is better.
Yeah, that's good.
Okay, so the COVID-19 pandemic came to us unprepared. And coming from a low and middle income country such as Nigeria, we already have a shortage of healthcare workers, particularly nurses. And so already the work is so enormous for a large population with shortage of healthcare workers. So we had to cope with the little resources that we have. And, you know, a lot of times I find myself having to move from work to home, sleeping at home, and then going back to work without a social life. So that has been the picture before the pandemic. And now when the pandemic came in, you know, everybody was unsure of, because of its novelty. We don't know how it's going to be like. You know, everybody's scared. And at that particular time, I worked at the emergency unit of a federal medical center in Nigeria. This center is also a referral center for Ondo State. Ondo State is a state in the southwestern part of Nigeria. So I worked in a referral center in the southwestern part of Nigeria at the emergency unit. So what this means is the emergency unit is the first unit you have to get through in an hospital. And so when the pandemic came in, everybody's scared. We had very little PPEs to protect ourselves. And
what did you have? I mean, did you have proper, you know, medical standard masks? And
we had, at first we had no medical standard masks. We only had the normal, you know, nose mask. And there was also an inequality about the PPE. For example, for me with a very short stature and, you know, shorter hands, I find it very difficult to use the gloves that were provided because the gloves were just the same size.
Right.
And so they expect everybody to use the same size of glove,
right,
which I find difficult to use because of my stature. And so these are one of the personal challenges that I have to go through. I have to like produce my own, find a way to have my own pairs of gloves to be able to protect myself. And so I find myself going to work scared because I don't know if I'm the next person to get infected. I mean, I see people getting infected with COVID-19 every day. I have to deal with them. And beyond that, I also have to deal with patient relatives who are scared, relatives who want explanation about how to take care of, you know, what happens next to the pandemic.
Yeah.
And because I am built to provide care and compassion, I have to look, you know, away from my own fears and also try to, you know, create empathy and create hope, not just to the patients, but to the relatives. But, you know, while trying to care for all of these people, nobody cares about me. Because in the inside, I am also burning.
Yeah.
I am burnt out from the pressure of the work. I have to go to work every day. And sometimes I have to take up additional shifts because, you know, there are people coming down with COVID-19. Some of these health workers are on quarantine. So you have to fill up the spaces.
Of course.
Yeah.
Were there support systems of any sort in place to help you and your colleagues who were really struggling to cope.
To cope. So we have to fill up these spaces. And, and so all of these actually, they all collaborated with me coming down with burnout and anxiety. I am anxious because I don't know if I'll be the next person. I am anxious because I am just tired of going through the same phase and the same process without anybody actually asking me if I'm fine. And, even if somebody would have asked me if I'm fine, my answer would have said, oh, I'm fine, I'm good.
Yeah.
Because, of course, I have to be there for people, And then, so this actually continued over and over again. And it got to a point, that was 3 months into the pandemic, where I had to just, lay into my room and cry. I cried onto my pillow because I was really tired.
Yeah.
And I started feeling the bouts of depression coming in. But fortunately for me, I was able to get help with Mentally Aware Nigeria initiative. That was earlier. But one of my friends were not so lucky. One of my friends slid into depression and wasn't able to, move out of it early. And currently, he's out of the nursing profession. He just couldn't cope with the pressure anymore. Yeah.
I mean, you saw the graphic showing the numbers of nurses who are leaving the profession and other health and care workers. Have you ever thought about getting out of the sector, doing something else?
Yes.
You have.
Yes.
Are you still a nurse?
I'm still a nurse. I'm still a nurse. But, sometimes when you get out of work and then you feel the pressure, you just want to have a less pressured space where you can. But, of course, the reason why I still stay comes with the fact that what I do is from a passion to actually bring hope, a passion to actually continue to, help people survive and to actually provide the best possible, helping people to achieve the best possible level of care. So I think that's already a set of passion that keeps me going.
Well, that passion is coming across, and good for you for having it. So you're Minister of Health not in Nigeria, so you can't address the system in Nigeria directly, Minister, but you can talk to me about Egypt and reflect on what Rafiat's just said. I mean, I dare say, I don't know, but I dare say nurses in Egypt have been under similar sorts of pressure. Some of them might also have wondered where the support was coming from. So you tell me how, having listened carefully to Rafiat like I did, how you are trying to address this very important question.
Absolutely. I think what happened to her in Nigeria is also happening everywhere, not just in Egypt.
Yeah.
During especially the first and second wave of the pandemic in the first year. But let me start first by addressing that health doesn't mean only physical health. By definition, that means physical, mental, and social health and well-being. So we all forget about these two other sectors, and we all focus of treating patients physically, not just keeping so much focus on the mental and the social part of the health. And talking about the healthcare workers, and I think it has been always a challenging, but as you just mentioned, Steve, I think during the pandemic, things are exaggerated a lot and focused. Because of a lot of fundamental elements that happens during the pandemic in terms of fatigue, stress, exhaustion, burnout syndromes, losses and grief for healthcare workers, as she just mentioned. And taking in consideration actions by government and by hospitals, I think there is a lot of things to do. And I can refer to an important article, and also the report referred to some of a very important literature review and systematic review that talks about the mental health in healthcare workers. And I can quote that the prevalence of anxiety, depression, and stress, the study showed high parameters that sometimes reached up to 67% of healthcare workers and 55% and 62% respectively, especially in nurses.
So is that a survey you're referring to in Egypt or an international?
This is an international study that has been done during just the first year of the pandemic, which I'm sure that the report also had even a wider research that shows more or less same figures. And the younger medical staff workers in areas of higher infections and female workers are mostly the one to be affected by anxiety, depression, and stress. So I can tell that the suffer and the depression and anxiety has been in different places in the world according to different situations. But the pandemic taught us that that we are in the same, as I said, in the same storm, but
Definitely.
we're in different boats.
So then the challenge for you as a national minister is to consider Egypt and ask yourself, in the wake of the pandemic, do we need to do things differently in terms of the way we offer support, mental health support to health and care workers, the resources we put into it? Have you shifted some policies, done some things differently since the pandemic?
Oh, yes, absolutely. I mean, we started by some actions and steps like starting to raise awareness about mental health issues. And from where I'm coming from, still mental counseling is a stigma that nobody would love to go through. And we want to reduce that, and we want to educate people that you need to seek and ask for some counseling. And we did a lot of steps in terms of putting some online courses for our physicians and nurses. We also launched this 24/7 hotline services in order to help them with the psychiatric type of support whenever needed. So there's a lot of actions on the ground on an organization level or even on the Ministry of Health level to help.
Right. I mean, but part of it, as I think Howard was saying, is about sheer numbers. Staff in the healthcare sector are more vulnerable if they're overstretched, if they're simply being asked to do the work of, 2 people when there's only one of them, that kind of thing. I mean, I think the figure was 6 million jobs that should be filled are not filled within international health services. So in Egypt is one lesson of the pandemic that you need to spend, frankly, you need to spend more money on the health sector, and you need to boost your staffing levels, because that is one way to minimize or reduce the pressure on individuals within the system.
Absolutely, and we have another problem of draining healthcare providers outside of Egypt because of a lot of reasons. So we're not just facing the problem of that physicians and nurses will think of changing their jobs, but we're afraid of the future in the next 10 years that there are going to be less supply from physicians and nurses to go to schools, medical schools and nursing schools and other medical issues because of what happens in the last couple. So we need.
You mean because it's seen as a less attractive career option?
Absolutely. I mean, it takes a long time. You are subjected to a lot of stresses, a lot of depressions, a lot of workloads, and there's other jobs that seems to be much easier and more rewarding for them. So the problem is the future that we are looking for in the next 10 years.
That's very interesting. Are you seeing that? Anybody feel free to chip in. But in terms of the pipeline, I suppose the sheer attractiveness of going into health and care, has the pandemic, do you think, put young people off?
The jury is still out for me on that, Steve. I had a lot of people say at the beginning of the pandemic, because we were getting pictures of the work that nurses and health workers were doing beamed into our TVs, to our living rooms every night. They were seeing the phenomenal job that nurses were doing. Yeah. Could it be a recruiting sergeant for people to come in the profession?
And that sort of angel narrative that, oh my God, these people are saving lives, and we were all clapping, well, certainly in Britain, we were on our doorsteps clapping for them. Maybe that was something that a lot of young people thought, you know what, my life could be meaningful doing that. Maybe it drew people in.
Well, let me just, yes, but it was more than that, because that angel, it's a dreadful stereotype. It's a dreadful stereotype. What I thought the pandemic showed me, listen, the intensive care nurses, with all of those equipment, with those drug regimes, the complexity, the technical work, as well as the care and the compassion as well. I think that the pandemic did shift a little bit the stereotypes of nursing. But equally, What I then had conversations with nurses who were saying, you know, best job in the world, or I haven't got the PPE timely and quickly. The fact my health system wasn't prepared, I'm the one who's dealt with the consequences of that. I am still waiting for my, for my vaccine dose. Actually, it's the worst. Is it the worst job in the world? And I think both of those, glass half full, glass half empty for me, our challenge is to turn it into the glass half full. But people are savvy. They need to see not just the words of value and not just the applause, but they need to see decent, safe working conditions, to feel valued at work, to feel that their contribution makes a difference. To employers as well who take account of their needs. We talk a lot about recruitment. That's a 4 or 5 year solution plus. What I think all government's employers should be really focused on now, retain, retain, retain. The worst thing is if we're losing more staff now. What do we need to do to retain? Listen to your workforce. Listen to people. What do they need? They may need some time out. They may need some flexibility because of other issues they've got going on. They want to feel that their voice is heard in their organisation as well. Those things, I'm a strong believer that the world's nurses need a pay rise, so I'm not saying...
Well, you just haven't mentioned one thing that I would have thought would be quite important, which is pay.
Well, and I will come on to, I will come on to that. But those other things that I mentioned... And you think about all of us in our own job, if we really, really feel valued by our employer and listened to, that can go a huge way to hold you in the workforce. But pay around the world, we have seen it fall in real terms, combined with the cost of living crisis that we're seeing now as well. Frankly, many nurses are looking at other sectors and seeing the opportunity to earn more, perhaps to work a little bit less, and not to have the complexities and the challenges that are going on. On average, Stephen, on average, we pay our nurses about the average salary for the economy, whatever your economy is. And my challenge back is, are nurses in pay terms really the average worker? In some places, they're below that. And I think that's a big, big question about how we value, how we
Well, as you say, value can be discussed in many different ways, but one of the ways is literally value in terms of what you get paid. Rafiat, the danger is if a panel is, we can be too focused on the cultures we know, and a lot of us live in the West, and it's really important to keep coming back to you to get a sense of how it works in Nigeria, for example. So without getting too personal and asking you what you get paid, would you say that a senior and experienced nurse's pay in Nigeria is, I don't know, how it relates to, say, a teacher's pay? And would you say it's about average for salaries in Nigeria, a little bit above average, below average? Where does it sit? And don't worry, I don't want to get too personal. You don't have to tell me too much detail, but I'm just interested how it works.
Okay, so currently for a qualified nurse with a bachelor's degree as minimum, I think that the pay is lesser than average.
Less than average?
Yes, because when you try to look at it comparatively with the level of other people, other qualified professionals with a bachelor's degree for a minimum standard, it's, comparatively low. Yeah.
So, I mean, again, feel free to be personal or not, but when you said to your parents, I want to be a nurse, I want to train to be a nurse, would your parents have regarded that as a great career choice, or, oh, God, can't you think of something that's going to give you a better life? What would they say?
In Nigeria, there's usually a sort of pride when you work in the health system. And so, parents don't really know about the challenges that you face as an healthcare worker. What they know is that, oh, my dad is an healthcare professional, and that's fine. Yeah. So, of course, they would be proud. They would feel proud to be parents of an healthcare worker, but they don't know the challenges that we face over there.
Yeah. What about Egypt, Minister? Again, just in rough terms, your nurses, are they getting nationally sort of average salaries? Are they paid below average?
No, this is a national issue that has been announced by officials that physicians and nurses are underpaid.
Underpaid?
Absolutely.
What are you doing about it?
Well, now we are working in a big project trying to look back at the salaries and the wages of the nurses and physicians, and trying to raise this salaries, but considering the economic situation worldwide now, it's quite difficult.
Oh my goodness, that's such a politician's answer.
Yeah, well, I have to say that.
All you had to say was, I'm going to fix this problem. They're getting a great big pay rise, but you didn't say that at all. The truth is, you're not going to give
Didn't
them...
work for you, I know that. But I have to say that. But you know, I mean, it's a really a problem because, I mean, we, as I said, we are suffering from immigration of healthcare workers outside Egypt to the West.
We have lots of great Egyptian nurses and doctors in the UK healthcare system.
And we need to stop that.
Yeah, which creates problems for us, but that's our problem, and we need to train up our own nurses and doctors. But how you're not going to stop it unless you make it much more attractive on every level, from pay to regarding the support systems and the well-being systems that you put in place for your professionals. That's the only way to address it. So you're going to have to find the money somehow, and the resources and the political commitment.
Money is an important part, but it's not the only angle. We are now focusing on training, on postgraduate education, on decent life, in giving them a lot of incentives. But certainly we're working also on the wages, because we know that this is a whole package that needs even respecting them, protecting them from violence, from patients, and that's another important issue. That's a legislation that we are working on right now with the Senate, Office of Senate, in order to address. So it's a package. Part of it, and an important part of it, is the wages and salaries. You're absolutely right, but we need to look at different angles in order to try to maintain and keep and stop draining our valuable physicians and nurses and healthcare providers to outside Egypt.
Well, thanks for being honest with us. Hanan, you sort of look at this internationally. Let's not just be completely negative. Where can we find some great examples of where healthcare systems are learning how to properly value health and care workers?
Sure. So let me just first say that I think the nursing community is very, very lucky to have an advocate like Howard. And the reason I say that, it wasn't just meant to be a compliment to him. The reason I say that is because there are other health professions as well that need to be acknowledged, just like nursing. And I think it's important that we recognize in this conversation that a lot of the deficiencies we've been talking about, the pay gaps, the working conditions and so on, apply to others, and others who are not necessarily at the quote-unquote front lines. And so their issues have not necessarily been brought to the forefront in this discussion. But to answer your question, we did look around for exactly that, for what happened in what were some good examples, and we cite in the report a couple of examples, one from Australia and one from Qatar, and they were about providing support confidentially, destigmatized, etc., to health and care workers. And I know that Ian Tully is here, so he can speak about the experience in Qatar. The experience in Australia was one that we cited because it was at sort of a national level where resources were put in, and there was a lot of use of those resources. But I do want to say that everything that we have seen in the literature says psychosocial support is great. Having access to hotlines and to educational materials and all of that is very important, but there are structural issues that you cannot get around. And if you read what health and care workers say, they recognize that entirely. So they say, the meditation is great, the hotlines are fantastic, but we need decent pay. We need more breaks. Actually, in one of the surveys, I think it was the BMA, the British Medical Association, where they talked about moral injury. And I'm very proud of our report for bringing up issues that have not been discussed as much, like moral injury. So in one of their surveys, they say that, this existed before COVID. It got worse, according to the reports of their respondents after COVID, and they recognize understaffing as one of the top reasons for that. So again, I think we found good examples of psychosocial support that was provided, quite comprehensive, and we cited that in the report, but you cannot get around structural issues and policy reform.
No, that's powerfully put. Thank you. I should say at this point, I should have said it earlier, but I hope you know that I love to bring audience participation to the fore to get this to be a very interactive session. Well, good. So you figured that out already. So I think what I should do right now, having hogged the questions myself for a while, is get you guys to ask some far more intelligent and important questions, because I know there's a lot of expertise here. So raise your hands and we'll get the microphones to you. We'll start on this side. We've got lots of hands up on this side. So microphones, if you can reach people with the hands up. The rules are simply identify yourself and ask me as concise a question as you can. Keep it as brief as you can. Yep, go on, ma'am.
Hello, my name is Sarah Alem and I'm Egyptian journalist, but I'm currently living in the United Kingdom. I'd like to highlight what the minister said about the current situation regarding the Egyptian medical staff. But I'd like to ask about the need to employ new policies towards the medical insurance companies that neglect or ignore the psychiatric need or the therapy need completely out of its package.
About insurance companies?
Yeah, insurance companies usually in some countries ignore the need to have like a therapy or this kind of stuff. However, in Egypt, we can easily access our public hospitals to have this kind of therapy. But I think we need such.
Right.
Yeah.
So insurance companies need to take on, the reality of the need for psychiatric support. Minister.
I think she's right. I mean, she's talking about the universal health insurance system in Egypt and the scope of coverage that we should include mental health counseling.
So it's not covered. Mental health doesn't appear.
It is not, because we just started this universal health insurance system in just 6 governorates, but certainly you are right. And we are now studying to include that to the package of coverage to the beneficiaries. And but we have been doing that in a long time through our sector and the Ministry of Health that deals with mental health and addiction hospitals. And we've been doing that for free. But again, we need to do that on a routine basis as a part of the listed packages for, you're right, I totally agree with you.
Good. Well, that's good. Good question. Let's get more people involved. Yep, go on, ma'am. Just start talking and hope for the best. See what happens.
I hope that, yes, okay. Hello everyone, my name is Iris. Thank you so much for the opportunity. I'm a medical doctor from the Netherlands, currently a PhD student at the London School of Hygiene and Tropical Medicine. My question is, we've been talking about COVID-19 and there are other major health emergencies, including climate change. We see an increase of climate anxiety amongst particularly young health workers. What else should we do in addition to combating these long-existing systematic challenges for health workers in the context of health emergencies?
Right. Who wants to take that on? The sort of multi-layered anxieties that health workers are, particularly younger ones perhaps, are going through, including increasing climate change anxiety. Is that something that healthcare systems have to address? Anybody? Whoever?
I'll give it a start and then I'll turn it over to Jim, because I think, we've had these conversations. Let me just say this. Certainly, COVID-19 was neither the first nor is it going to be the last challenge. But I think what our challenge is to incorporate the learning that happened with COVID-19 into systems. And if you don't do that, we're going to start from, square one every time there is a new emergency. So the key is to make sure that all of this learning, all of these things that we've been discussing get worked into the system. And what do we mean by that? I mean, we lay out in the report, and I'll again turn this over to Jim, but we lay out a number of needs that have to happen at the service provision level, at the system level, at the policy level, everything from, monitoring and detecting mental health issues like anxiety, whether they're about climate change or, there are a whole host of other issues that are coming up. For example, right now in Europe with the energy crisis and so on, people are extremely anxious about what's going to happen. But what's important is to have systems in place that would continuously survey and monitor and detect these issues, be able to intervene on them early in ways that are appropriate, to provide the appropriate supportive services, as well as a host of, whole other, again, systemic improvements that need to happen. But I guess that's my point, is they just should not be individual piecemeal initiatives, but rather systemic change. And Jim, I know you want to say something about that.
Yeah, I think both the questions that we've heard here, Stephen, are actually coming back to some of the recommendations in the report. So the question there from Egypt, one of the key recommendations, what will work is to increase access to mental health care services, confidential mental health services for health and care workers. And that may be by including that in the social health insurance coverage. It may be making it free at the point of delivery. Similarly to the question from Iris, from the medical students there, the anticipating mental health needs, what we must recognize, and the minister made it very clear, there's so much stigma associated with mental health illness, especially amongst the health and care professions, that people haven't been coming forward. They haven't been expanding on this. And it's the underlying prevalence that we're seeing is so high now. So we need to anticipate that. And whether that's for climate, which is real, we're seeing, the impact of climate in this summer, the downpours, the rains coming through, impacting people's lives and livelihoods. Whether it's anticipating that, whether it's anticipating conflict, whether it's anticipating what we see with, during conflicts in terms of the treatment from one human being to another, and then how people cope with that, and make sure we have those services available. So climate control, yes, but it's one of 4 or 5 critical things for the future.
But it's interesting you talk about stigma, and it's never easy in any working environment to say, I'm not doing well, I need help, I'm vulnerable. I mean, that's not easy in journalism or anything. It's not easy, but obviously you want people to feel safe to be able to say that. But isn't there another form of stigma that in a lot of health services and institutions, there's a stigma about speaking out, about being disloyal to your organization. If you see that bad stuff is happening, maybe some of your colleagues aren't meeting the standards you think they should meet, or the equipment you're being given is crappy and you blow the whistle on it, you are then stigmatized as being disloyal and letting down your hospital or your colleagues. How do you get around that? Because that's a real issue.
And we've seen this, not only have we seen the infections amongst health and care workers, the deaths, the unfortunate number of suicides, depression, but we've also seen the greatest ever increase in protests and whistleblowing about the conditions of work. And the information both from the literature, the reviews, the workforce, the online information sources that WHO checks, nearly 3/4 of the world has had some form of labor protest or strike from its health and care occupations in the last 2.5 years. And that is coming back to the same thing. And then we're looking at the evidence of what is the reaction, Stephen. What's the reaction to this dialogue, to this protest, to this strike? And we're seeing jurisdictions expelling people from the workforce, which cuts off livelihoods. We're seeing people being arrested. We're seeing people jailed. We're seeing people expelled from positions of authority to come forward. So just for talking up, because exactly that, you're not part of the team. If you're speaking out on these issues, you're not actually part of the team. And we've got to try and address that issue as well.
So Rafiat, honestly, when you were facing very difficult situations, when your PPE equipment wasn't good enough, and you could see that the facility you were working in wasn't meeting the right standards. Did you feel safe to complain, to speak out, to make it plain to your superiors that this was not acceptable?
Yes. But there's always a level always a level of depth in which you can talk to. I tried communicating that with my manager, but I can't talk in depth about the level of burnout that I feel. I can't be so personal about the level of anxiety that I feel, because I'm scared that if I tell her that I'm always feeling anxious and all of that, she might lose this confidence in me trying to provide the best of care to people. Although I did tell her about how I'm able to the burnout and all of that, but not in depth. And of course, I also communicated with my PPE and all of that, but none of it was actually solved, because it's a whole lot of process.
Yeah.
When you want to get things right. And then even when you try to communicate, sometimes people don't listen. You just talk, and then if you don't have the necessary level of connection to actually make a difference, you just realize that what you say goes out of the way.
Doesn't make a difference.
Yeah.
Yeah, well, that's interesting. Thank you for telling us all of that. Right, we've got lots of hands up, so we'll try and get through some more questions. Again, identity, and keep it as brief as you can. Just keep talking, it will come. Well, I think it will.
Everybody's talking to improve the nursing status. That's very good. People are asking the government, the nursing advocate, and others to support nursing profession. But my question is that, sir, the companies, especially I'm talking about pharmaceutical companies, and those companies, those who did online business, they earn millions, and their earning was based on my pain, your gain. So why these companies are not being asked by the government to contribute the amount of profit for the improvement of the nursing process? Because pandemic-like situations will come in future, and people will go under anxiety, depression, everything. So there should be a proper channel to extract or to share this profit from the companies to improve the condition of the nursing profession.
Okay, well, so what about that proposition? The private sector companies that make big profits from the healthcare sector, including, I guess, big pharma, there should be a means to extract some of that profit to pour it back into investment in the right support and salaries for nurses. How about that? Sounds... I mean, I guess we're all smiling because we think, oh, that'll never happen. Why shouldn't it happen?
I think that people are ahead of politicians on this. And I could just give you an example of, in Switzerland, the Swiss Nurses Association, in Switzerland they love a referendum, and you can call a referendum on everything. The Swiss Nurses Association instigated a nationwide referendum to get a load more money for nurses.
Right.
And this is a big thing, because you've got to win it in the counties, in the cantons, as well as at a country level. And the government said, you're only doing this on the back of COVID.
Right.
Swiss Nurses said, well, sort of we are, because it's shown how unprepared we are. We can't make nurses a special case. The government said, why not? And they said, and we can't afford it. And that was the government's case. The Nursing Association put all of the arguments you'd expect the Nursing Association to put out there. And they won. They won 70% of the counties, and they won 60% of the national vote. And I genuinely believe that part of where nursing is going, I think the question on climate change from the students is I think that's a real signal of optimism that I see in nursing as well, because what the students are doing, they're seeing the impact of climate change in their practice, and they're saying, actually, what we need to do for good global health, we need to do to save the planet. When I talk to nurses in Pakistan with the flooding, they say, yeah, our health facilities have gone, we're worried about infectious diseases, but there's no food, there's no housing, there's no employment. So our students are following health into, what do we call it, the SDGs, but into all these other areas. and that's my hope, my optimism, is that I think that our future health professionals are going to be much more vocal advocates for a broad range of social, political, and economic issues, not because they want to become political directly, but because the health arguments, the health issues are taking them to that place. And when you combine that with what the people want, because we know if there isn't sufficient resources and funding for healthcare, if there aren't the nurses, who's going to pick up the care? Us as family, us as friends. It's going to fall on us to do that. And I think that a lot of the population recognise the bang for buck, the cast iron investment that money in nursing and healthcare gives them in a way which, when I said before, with the politicians that use the currency issue. So I think that the future generations following health for these big global issues, being advocates, having a stronger voice, and aligning with people and populations, there's some optimism there for me about shifting some thinking, and perhaps that is some really radical thinking about, taxation policies and what's fair.
It does sound like, I mean, I'm not saying this in a judgmental way, but it sounds like, you foresee a politicizing of nursing.
I'm following the health arguments. I'm following the evidence and the impact and the implications of health to where that takes me. And of course, that takes us to a place where there are choices.
Yeah.
And there are political choices. And I think it's legitimate. I'm not saying I'm not in any way calling for the profession to become partisan or to take one political view, but I am saying get involved in the debate because it's a choice and ultimately it's a political choice and our voice should be heard very, very loudly as part of that.
Feel free to applaud if you like it. Don't hold back. Yes, right. Back to questions. Where are the microphones? Okay, so you've got yours. So don't worry, we've got a bit of time, so we'll hopefully get to everybody.
Thank you all. My name is Muhammad Mudabbar, a registered nurse from Sudan, serving Vaccine Institute Immunization Advocacy and Nursing Now Challenge. I have 3 questions.
You have 3?
Yeah.
No, you can't have 3. That's because there's loads of other people. Give me your best question.
Okay. So my question is directed to His Excellency Minister of Health of Egypt. To what extent migration of Egyptian nurses have impacted Egyptian health system, and what measures has been adopted by the government to tackle the root causes of migration of Egyptian nurses? Thank you.
Right. So, yeah, are you addressing the root causes of the migration of Egyptian nurses?
As I said, I mean, this is not just for nurses, but we are certainly addressing all the root causes of this immigration. And we've talked about that, about the wages and about the social standards of living and about education and training. So there is a lot of issues that we, with the syndicate of nurses, we are meeting on a weekly basis in order to try to make things easier for them. As I said, things we can do fast and things that we are working to improve that. But it is an issue that we have to address and we have to find a way to solve that.
But I don't want to be simplistic, but how powerful is the Minister of Health when he faces the Finance Minister?
A good question. I mean, you lived long enough to know that. I mean, but in everywhere, in every government, there is usually a battle between ministers that provide services and the Minister of Finance.
I know, but in many systems, unfortunately, the Minister of Finance wins the day.
We are lucky because the President is on our side. So whenever we ask for that type of increase the budget, and as a matter of fact, the President of the Republic of Egypt, he just announced and instructed the Ministry of Health to start working on a draft for a resolution and solutions for that aspect. So that's what we are working now. And now when my colleague, Minister of Finance, received that same instruction, he's working hard to do that. So I believe that we are now having a presidential will and a government will to address this from the roots. So we're trying to do our best in order to keep our nurses, keep our physicians, because we know that these are the most valuable treasures of Egypt for combating this pandemic and any future pandemic.
Well, I'm sure Wish would love to have you back in a couple of years to see who really won the battle.
I won't be here. I won't be available.
All right, we want to get more questions in, so we'll go to you, ma'am, and then I know. Oh, sorry, no, sorry, you've got the microphone, ma'am. I promise you, we won't forget you, but this gentleman has the mic, so.
Okay, thank you very much. My name's Ian Tully, and I'm based here in Qatar. Thank you very much for the presentations. We've touched on a lot of things around the structural, political, economic issues in regard to healthcare workers, and clearly we need to shift the paradigm if we're going to see well-being amongst healthcare workers. But I wanted to get back to the report, and Jim did touch on this in one of his responses, and that's around how do we shift the stigma that prevents healthcare workers from seeking the sort of help they need as far as psychological well-being is concerned. Our experience in Qatar was COVID made it much easier for people to seek help, because saying I was anxious about my family or about COVID was okay. Say, as a physician, saying I'm anxious or depressed or have an alcohol problem becomes a very difficult thing to do outside COVID. So moving forward, what would be the one thing you would recommend that we think about in terms of improving access to psychological help for healthcare workers across the board?
Good, thank you for the question. Jim, do you want to answer it? Because
Indeed, we've covered this in the report, and making that access to care critical. But I think there's two components again. How do we enable, how do we empower health and care workers to feel extremely comfortable to come forward with that and not to be judged, not to be put in a position which is negative, not to be concerned, use the relationships with the supervisor, use the relationships with others to access that care. So the role of the individual, the role of the associations to support that through whether that's the medical association, the nurse, the midwives, the pharmacists, anyone, whether it's the hospital porters, Stephen, who are also, all the team involved in delivering health and care. And then the informal professions, the care workers, to be enabled. And then the role of the organizations and employers to come together. And that's, I think we see, you mentioned the word there, Sari, dialogue. How do we really get people to start to talk to each other and to actually say, it's okay. I mean, I came to Wish a few years ago, and you may have been here, Stephen, when we had the famous swimmer, Phelps.
Yes.
Talking, it's okay not to be okay. And we need to introduce that, not just for the mental health of people in the spotlight, sports and everything else, but the workers in the spotlight that we're talking about, health and care. But just if I may, whilst I got that, part of this conversation, we're skirting around a whole lot of issues, but they're actually all connected. Yeah, they are really together. What the minister and Howard was saying about working conditions, the evidence, the review, the discussions, the lived experience. The reality is health and care is at a critical junction. In a couple of weeks' time, it's 1,000 days since COVID-19 was declared a public health emergency of international concern. 1,000 days. Surely in that period of time, we've learned something. Next year, it's the halfway point for the SDGs. Have we made progress against health and well-being for all at all ages? The world tells us that we're going to have less money to spend on education, on health, and social protection in the next few years because government revenues are coming down, which makes it a political choice. And if the minister is not the one to make the political choice, but the minister has the evidence, where's the Ministry of Finance in our discussion? And I doubt if there's a single representative here at Wish from the Ministry of Finance. We're talking to each other. So we've got to go beyond that. We've got to protect, safeguard, invest in the workforce, but do that with the education sector, with the finance sector, with the Prime Minister, the President on our sides. Otherwise, this 1,000 days of learning from COVID will be back here when it's the next emergency.
Yeah, yeah. Thank you, Jim.
Can I just add something?
Briefly, because I want to
Very
get one more
briefly,
question
yeah,
in.
but
Yeah.
it's on the same point to Ian's great question. You know, how do we change the stigma? A couple of things we came across. One of them is, you know, the stigma for mental health, for example, in our culture, in the Arab culture, but also in other cultures, is very real. In the healthcare professions, it was very much tied to fear of losing their license. Right? So I think that's something for regulators and for administrators to take seriously, that conversation about you will not lose your license because, you know, if you get sick, then you are protected, and if you are not well, you're not protected, and so on. So that's one. And two, because I know we have medical students in the audience, part of it is also the culture that starts very early in education, that, you know, where physicians, and to a lesser extent maybe nurses, but very much physicians are told that they cannot be vulnerable and that they, you know, that they have to project an inordinate amount of strength. And so I think starting also on that socialization process very early in education is also important.
Okay, thank you very much, Anand. Ma'am, you get the last question because we're going to have to close after this one, so go for it.
Hello, I'm Sharon Brownie, and I currently work in nursing education rather than actually in the health service. And I'll try and be brief because of the time. Currently, this renewed emphasis on mental health and well-being is extraordinarily important. But my view is, and what I'm seeing, is that it's an incredibly major risk as well. The risk is that suddenly so many resources are being poured into cadres within health, human resource departments, within admin systems. Every organisation I know in terms of education is now developing and consulting their staff on wellbeing programs. What I'm hearing is a bunch of very angry academics saying we have had years and years of productivity commissions, more teaching hours, more marking. We have no life left to be an academic. Why would I be an academic? And now you basically want me to participate in a wellbeing program that's going to use other university resources rather than why didn't you actually give me a job that's not making me unwell in the first place? So how are you going to get that balance right or advocate for wellbeing programs without actually drawing more resources from an already strained system and to actually get that balance right?
Yeah, it's a good question. Maybe the pendulum in its swing towards recognition of the mental health issues could go too far, and it could actually create a whole new set of problems. You guys who wrote the report, do you recognize that as a danger?
Yes and no. Maybe that's a politician's answer. But no, I think the report states this explicitly, and this is part of the thing. We didn't focus on the individual resilience, but we focused on the organizational capacity to reduce the risk factors. And that's the critical thing. So
but you don't want to then you don't want organizations to pour resources into building a whole sort of HR bureaucracy that may not be super efficient, but will certainly suck up resources.
But they don't have to. That's the point is, you know, I take your point completely, but I think part of the problem is what we conceive of as well-being and what brings about well-being. So it's not about putting resources into you know, necessarily into more training. Well, training is important for certain things, but I mean, it's the kinds of investments that we are calling for in the report, the kinds of investments that we are calling for in the system should actually be cost-effective and risk mitigating in the longer term. So I think we need to stay that course and not say, you know, we're pouring money into well-being initiatives, because when we say that, we're usually thinking about sort of very short-term, superficial kinds of interventions that in the long term are not what we need. But if we make the kinds of changes that we are calling for in the report, the kind of systemic changes, then those are definitely going to make everyone's life, including academics like myself, much better.
Well, all I can say is you asked some fabulous questions, much better than the ones I thought of. I'm sorry, Hans, but we've run out of time, and you know, we all probably deserve a bit of a break and a cup of coffee or tea or something. So, but unfortunately, we also have a schedule to keep. So, being chairman, I'm afraid I am going to have to draw a close to this. All I would say is, The questions have been fantastic. I'm so pleased that so many health and care workers have been in the audience, because that's added to the sort of insight and experience. But also, I'm so pleased that we had a panel who truly engaged with the issues, and it's obviously important we all read the report. And with that, I'm going to draw this to a close and ask you to thank the panel one more time. Thank you all very much. Thank you. Thanks.